There is an ultra-rare genetic disease that has potentially life-threatening painful attacks that can't be diagnosed easily, leaving the patient struggling with mysterious symptoms that include abdominal pain, weakness, nausea, fatigue, respiratory failure, confusion, and of course, anxiety. This genetic disease is called acute hepatic porphyria. Research shows it can even occur between the ages of 20 and 30. Joining us to create awareness of porphyria and its symptoms is Dr. Bruce Wang, assistant professor at the University of California, San Francisco School of Medicine, and acute hepatic porphyria specialist in the care and patient impact, along with Mary, a patient who suffers from the disease. Good morning, Dr. Wang, and good morning, Mary.
Good morning.
Doctor, as a journalist, I have covered rare medical diseases for many years, though I've never heard of acute hepatic porphyria. So tell us about this rare disease and how it can debilitate a patient's life.
So the acute hepatic porphyrias are a family of 4 different rare genetic diseases. It primarily affects women during their reproductive years. It presents with severe, potentially life-threatening neurologic damage that most commonly includes abdominal pain, but can also include numbness, weakness, and mental status changes, and can be very debilitating to patients.
So how many people in the U.S. live with this disease?
We don't actually know the exact numbers, and it's one of the reasons why the National Institutes of Health is supporting a Porphyrias consortium to better study this disease. We believe that as many as 1 in 2,000 people carry the genetic mutations that put people at risk of developing acute attacks. But the number of people that actually develop attacks during their lifetime may be as little as 1 in 20,000 patients, which is one of the reasons it's such a rare disease and most people have not heard of it.
So why is this condition of acute hepatic porphyria so hard to recognize, to diagnose accurately?
So the primary reason is that the symptoms during an acute attack are not specific to the porphyrias. They're very common symptoms like abdominal pain, nausea, weakness, and numbness that can look like a lot of other more common disorders. And so it's oftentimes missed.
Now, Mary, how were you diagnosed? And did medical experts diagnose you quickly? Or was it a long, dragged-out, problematic diagnosis?
For me, I was actually diagnosed quickly, 12 attacks in 18 months. For many people, though, they can go 12, 15 years without a diagnosis. My diagnosis came about from sheer luck. I was in the emergency room with my 12th attack, and I'd given a urine sample that looked like port wine. And I had a doctor walk past the room and see it, and pick it up and make a joke to the nurses about drinking wine from urine sample cups. When I called out into the hallway that it was my urine, he came into my room and questioned me. And he told me, "I think I know what you have." And the only reason that idea was in his head was because he had seen a movie that discussed porphyria 3 nights prior.
Wow, so it was a fresh medical topic right on his mind.
Exactly.
All right, so doctor, this is a genetic disease. So if your parents had the disease, can a person do anything to prevent this condition from affecting them?
Well, there's nothing that you can do to eliminate the mutation from your body, but there are things that we can do to try to avoid triggers that can initiate an attack. And that's very important in preventing attacks from occurring in patients who are at risk for developing attacks.
So what can trigger these conditions?
So the most common triggers are actually medications. So a number of drugs are well known to trigger acute porphyria attacks. And a significant part of my education of the patients is to teach them about the drugs that are safe and the ones that they should avoid.
Mary, were your parents diagnosed with this disease?
I'm actually a very rare case out of the very rare because I had a spontaneous mutation known as is it de novo? So actually neither of my parents after genetic testing are shown to have it.
All right, Mary, so share some of your struggles that you experienced living with acute hepatic porphyria.
Well, I used to work, I used to travel, I used to cave, but due to the severe pain of porphyria in my stomach, my back, my legs, including a weakness, lethargy, paralysis in my hands, I cannot do any of those things anymore. I'm now living with my parents when I used to be a homeowner, and my life has just basically been reduced to my bedroom.
So, doctor, can you help Mary turn this condition around? Is there any new treatments or new research, anything to help prevent these debilitating attacks Mary is experiencing?
Yes, there's actually very exciting new research and potentially new drugs that are going to be available that may be very effective in preventing attacks in patients such as Mary.
Is this disease being found outside the U.S.?
So this disease is pan-ethnic, and the incidence prevalence is similar in Europe, and we believe that it's similar in the rest of the world as well.
Pan-ethnic meaning?
I see. So it affects people of all races.
So anyone can get this ultra-rare genetic disease, and it's now on the medical radar. And now research is happening, and you're a part of these new advancements.
That is correct.
All right, so tell us where we can learn more.
I think that what people can do is they can get more information from the American Porphyria Foundation. They can go to porphyriafoundation.com, as well as the company Alnylam at alnylampact.com, and get more information about both diagnosis of the disease as well as the upcoming new treatments that are available.
Thank you, Dr. and Mary, for joining us this morning to enlighten our viewers to this chronic, painful, debilitating disease and the many symptoms that patients experience.
Thank you.
Thank you.
Our experts today shared resources to help you create a strong support overall health system. Taking a proactive, positive approach to our personal wellness plays a significant role in preventing and detecting disease to improve our healthcare results. Share with us your personal approach to wellness at facebook.com/Rose Lee Show, and follow us on Instagram at The Rose Lee Show, and watch this episode and many others here on Discovery Life or 24/7 at RoseleeArcherShow.com. Thank you so much for joining us this morning. We look forward to seeing you soon. The proceeding was a presentation for The Rose Lee Show. The views and opinions expressed in this program are not necessarily those of this station.